I'd like to invite the member of the committee to introduce herself, starting on my right with Senator Walls.
Good morning, Senator Lynn Walls. I represent District 15, which is all of Dodge County.
Assisting the committee is one of our legal counsels, TJ O'Neill, our committee clerk, Jerry Williams, and our committee page, Kate. A few notes about our policies and procedures, please. First, please turn off or silence your cell phones. This morning, we'll be hearing 3 interim study resolutions, and we'll be taking them in the order listed on the agenda outside the room. The hearing on each study will begin with the introducer's opening statement. After the opening statement, anyone else who may wish to testify on the study may do so. Because this is an interim study, there are no proponents or opponents. The introducer of the study will then be given the opportunity to make closing statements if they wish to do so. For those of you who are planning to testify, you will find green testifier sheets on the table near the entrance of the hearing room. Please fill one out and hand it to one of the pages when you come up to testify. This will help us keep an accurate record of the hearing. We use a light system for testifying. Each testifier will have 5 minutes to testify. When you begin, the light will be green. When the light turns yellow, that means you have 1 minute left. When the light turns red, it is time to end your testimony, and we will ask you to wrap up your final thoughts. When you come up to testify, please begin by stating your name clearly into the microphone, and then please spell both your first and last name. With that, we will begin today's hearing with LR 184, and welcome Senator Wishart.
Well, good morning, Chairman Arch and member of the committee. My name is Anna Wishart, ANNAWISHART, and I am here to introduce LR 184, an interim study to look at the reimbursement rates for family service providers in Nebraska. Medicaid dollars that are paid to providers through service reimbursement are almost exclusively used to pay wages of people hired by these providers. And I want to preface this by I'm excited to speak in front of you today and to have this conversation today because we hear a lot about this in the Appropriations Committee. And so it's good to talk to the Health and Human Services Committee and get us all on the same page about this. So the result of service providers relying on their wage increases, depending on what we do in the legislature and what the administration does in terms of DHHS rates, that's what I really want to talk about today. So the past 10 years have seen Medicaid providers fall further and further behind the curve in terms of what the labor market in Nebraska can support. The legislature has traditionally provided somewhere between 2 and 3% annual increases in those reimbursement rates through the various divisions with the department. And sometimes the department has used their ability not to spend those dollars in some years. We've seen that with nursing care providers in the time that I've been here. So that's resulted in then even smaller increases in those percentage. In 2017, the administration vetoed over $32 million in Medicaid rate increases from the budget that we had introduced as an Appropriations Committee. And that was because we were in a really tough financial situation, as we all remember. And so that resulted in a 0 rate increase for those providers. So in each of those past years, increased costs continue to weigh on these employers. So even when we're not providing rate increases, the costs continue to go up for providing services. Health insurance, as an example, has increased over 50% in some years. In January of 2010, the unemployment rate in Nebraska was 5.5%. We fast forward to 2020, and the rate is 3.1%. And then the pandemic hits, and there's a total shift in terms of where people are working. And so that sent a lot of Medicaid service providers into a spiral in terms of being able to find the employment that they need, especially in rural communities, to provide services to people who depend on Medicaid. And now, as you all know, our unemployment rate is even lower at 2%, which means that these Medicaid providers are competing against other employers and other opportunities for employees to leave and find a better pay. And so that's really what I'm here today to discuss. As an Appropriations Committee, we have prioritized trying to get those rates to a place where they're competitive and you're not seeing significant turnover in staff for these providers. But what you'll hear today is that there is still a concern from providers at being able to attract employees and then also being able to make it budget wise. And so as an appropriations committee, we're interested in collaborating. Well, I am, as a member of the committee, interested in collaborating with this committee to find creative ways, whether it be rate increases or other ways where we can start to solve some of this issue we're seeing in our Medicaid service providers in terms of being able to attract and retain employees and then provide the services that a lot of Nebraskans depend on. So with that, I'd be happy to answer any questions.
Okay. Are there any questions? I have one.
Sure.
Have you started to have discussions within the Appropriations Committee regarding just the pressure on wages and what we're seeing in the market and how that could possibly affect not only wages for services that we contract for, but employees of the government and all of that? Has that now risen to a point of discussion?
Our committee has not met to have that discussion. We have had it in tranches when it comes to corrections in particular. But we've also had it when talking with, over the years, disability providers and how tough it is to find people willing to work in that environment with those wages. And then child welfare. We see a significant amount of turnover from employees who work in the child welfare industry, which is concerning. I mean, I personally experienced this as a foster parent. We had a child welfare worker outside of Cedars that worked for the department. We had 3 different caseworkers in 3 months. It was significant turnover. And we saw the result is you have somebody trying to catch up on a case when they're just in 40 cases, when they're very fresh on the job, and it's disruptive to the families. So I do think it's a conversation we're going to have to lean more into. And the other thing we're dealing with too is private employers are also struggling as well. And so you want that balance with the state not competing against the private industry as well, being able to grow and attract and retain. So
Yeah, I think there's some realities we'll have to deal with that we haven't had for many years, but
yes,
we'll have to wrestle with those. Any other questions? All right, thank you very much.
Thank you.
Now, will you be staying to close?
So I am going to have to leave if this lasts longer than an hour.
Okay.
And so I will not be able to, but otherwise, if it's within that time, I will.
All right, thank you. We'll now ask for anyone that would like to testify. However, I've been asked if we could show some courtesy to people that have traveled the distance here. We've got one from Kearney and one from Norfolk, so I'm going to actually call on them first. And Ryan Stanton, if you would be willing to testify first.
Good morning. Thank you, Chairman Arch and members of the Health and Human Services Committee. My name is Ryan Stanton. That's spelled RyanStanton, and I'm the CEO of Compass, which is based in the Kearney area, and I represent the Nebraska Alliance for Family and Child Service Providers. We're an association of 7 providers who individually contract with the HHS to provide child welfare services, such as family support, supervised visitation, and travel time for those same services, as well as some other services. Our services are paid through Program 354 in the DHHS budget. Together, we serve approximately 5,400 families in more than 60 Nebraska counties outside of the Eastern service area. And we have a combined 120 years of experience. Our 385 employees drive over 3.5 million miles annually, ensuring children and families receive the services they need. Before I go any further, I want to thank Senator Wishart for introducing LR 184. I'm going to spend a few minutes walking you through the contract process that we have for family support and supervised visitation that's taken place for well over 10 years between providers who serve the 91 counties outside of the Eastern service area and DHHS. I'll be followed by another provider who will talk about where we go from here. The services contract mirrors the state's fiscal year, which runs from July 1 to June 30. We typically provide we typically receive a new contract in June, and we're asked to sign it within a few days. In recent years, we've not been asked for much input, and the input that we have provided has resulted in little change. There is no negotiation process. We either sign the contract or we don't. which would result in the ability to provide these services for children and families who are in the child welfare system. So for example, in the 2018 services contract that we received, we had multiple errors that took DHHS days and several attempts to correct. A somewhat acceptable version was not able to be signed until June 30th, which was just hours before the old one expired. And it still required an amendment or two later. And speaking of amendments, the state often requires us to sign amendments to the contract only when it benefits them. Again, we do so, or we choose not to provide those needed services to children and families. As a result of this process, I want to briefly go over the handout that I've just provided. Some of you have seen this before, but I want to focus your attention on it again. At the top of the first page, you'll see that for many years we didn't receive a rate increase, and only in the last 3 years have we received a 2% increase in each of those years due to the Appropriations Committee. I hope you look at it and find it unacceptable, especially considering that the cost of doing business has increased roughly 30% over the same time period. The next chart shows that even before the pandemic, we weren't able to compete with DHHS or other entities in our communities in terms of what we're able to pay our employees. The second page outlines changes that DHHS has made to the contract over the years, and it has resulted in a decrease to revenue for providers. I could go over these individually and would be happy to do so, but in the interest of time, I'll just draw your attention to the third bullet under the staff training requirements. With this particular expectation, DHHS was excited because the training that they provided here was free. They received a grant to provide the training to their staff and providers. They were requiring us to have our employees attend this free 20-hour person training. It's true that there wasn't a registration fee. However, we have to pay our employees to participate in that training with no reimbursement mechanism from the DHHS. Also, it's taken most of our staff nearly 35 to 40 hours to complete. When we pointed this out to DHHS, they basically said, sorry, we didn't really think about that, but you still have to do it. So this is clearly one of many expenses that we've had to absorb. The third page outlines the cost increases to the contract over the years. I don't have to tell you that the cost of insurance and overhead expenses have all gone up in the last 10 years, and it's been much more than 2% over the last 3 years. Again, we've just absorbed this into the current fee structure because we didn't have a choice. In closing, I do want to say that the changes that DHHS has made to the contract have been good ones. I believe that we're better providers because of those changes, and families are better served as well because of them. However, these changes aren't free. They cost providers money. I know that some of you had several conversations regarding the contract process in the Eastern Service area, and I'm not super familiar with all the details surrounding that process. I just know that even though the contract process for the other 91 counties is not on the front page of the paper, it's broken too, and it's needed to provide services for families, and families will be impacted unless something is done right away. Again, thank you, Senator Wishart and Senator Arch, for having me here today, and I'll be happy to answer any questions.
Thank you. Are there any questions? Seeing none, thank you very much.
Thank you.
We'll ask Lori Millard to come next. Morning.
Morning. Morning, members of the Health and Human Services Committee. I am Lori Millard, L-A-U-R-I-E-M-I-L-L-A-R-D. I'm the president of Good Life Counseling and Support. We have offices in Norfolk and Columbus. I am also with the Nebraska Alliance of Family and Children Service Providers. I want to thank Senator Wishart for introducing this study for us to be able to present our concerns. You've heard from Ryan how the contract process has worked or not worked, as the case may be, between HHS and the child welfare providers outside of the Eastern Service area. As a result of this process, the limited rate increases and changes imposed on us by HHS without regard to the financial impact to providers has reached a financial crisis point. We can no longer deliver adequate services and hire enough qualified workers under the current rate schedule. Right now, we are competing with Walmart and Target with people that do not have bachelor's degrees, maybe high school diplomas, but we're required to have bachelor's degrees, experience, and have willingness to work hours on weekends, crisis hours, on-call hours. It's not feasible. The situation has been building over the past 10 years as providers have continued to meet the ever-increasing contract demands of HHS. The cases are getting more and more complex with the addictions getting more serious, and the dangerousness continuing to rise. Rising business costs, increased driving, all while being forced to provide under poverty level wages to our staff and under poverty benefit packages that providers cannot continue to provide. Yesterday, the providers in our organization and other providers across the state requested an immediate increase in rates for family support, supervised visitation, and the travel that is associated with those services. We are requiring an amendment to the contract. I've provided you with the letter that was sent to HHS yesterday. In our job market, we cannot hire and retain employees to provide family support, supervised visitation services, and related transportation at the current rate. We can't compete with other employers, like I said, Target or Walmart, including HHS, whose children and family service specialists are receiving a 20% increase in pay beginning November 1st for 2021, 20%. We are paying higher wages with more benefits and lower education requirements, compounding the higher challenges that are not guaranteed, the unpredictable work hours, with volatile families in crisis, in homes with drug addictions, domestic violence, unsanitary conditions. We're asking staff to go into these homes and put themselves at risk at a much higher frequency rate than the HHS staff have to put themselves at risk, with no reimbursement for that. Compared to January 2020, all of the providers in our survey, 25 to 40% fewer employees are on staff to provide this service. 30 to 50% in applications even coming in for the position. Our annual turnover rates have increased to an excess of 60%. That's huge. Each of us has waiting lists of 20 to 45 families. That means services are not being provided out in rural Nebraska for those people on the waiting list. We've worked collaboratively with HHS to offer the highest quality of services possible and to benefit the most vulnerable in our state. Prior to starting Good Life in 2000, I was a caseworker and a supervisor for nearly 20 years with HHS. I know how it works. I've worked in it. My goal to start providing hands-on services was to be able to help families in crisis. And we've got excellent working relationships with the state. There are other providers that did the same thing to enhance services to children and families that were in need. We want to keep our doors open. We really, really do. We know these families need help. The kids need help. We've requested hourly rate studies for over 5 years to determine an actual cost for supervision. They've been verbally consented to, but have not been met. There's been no follow through. Now, we as businesses and the vulnerable families in our state, we don't have time to continue to wait for an appropriate value for the services provided. In that end, we've determined a fair and suitable rate that we need in order to continue serving the people of Nebraska in the manner they deserve. Based on the calculations in the handout that I provided, we need a minimum hourly rate of $65 for family support and supervised visitation. That rate needs to begin when children or families are in our vehicles. This allows us to be minimally competitive in today's employment market. Providers also need an hourly rate of $35 minimum for drive time, plus the federal mileage rate without driving children or families, when we are driving children and families in our vehicles. This enables our employees to make a survivable living. We hope this rate increases by December 1st of this year, 2021. In the last month, Providers have already refused or returned over 200 unique cases to the state that are not financially viable. We're already turning down cases. That number will continue to significantly increase as we make a concerted effort to only take cases that make good business sense, leaving the other cases to be serviced by overworked and overwhelmed HHS staff. To be clear, we cannot afford to serve some people who live in very rural areas. We cannot require significant drive time to receive services. For example, up where we live, a 2-hour drive time to meet a family for 1 hour with a 2-hour drive time causes extensive loss to our agency. We can't do that.
If I could ask you to summarize, your red light is on as well.
Oh, I'm sorry. Families who have a history of not being able to work with providers. The system is broken across the state, and we're asking for it to be addressed immediately. So I'll be happy to answer questions.
I haven't had a chance to read your letter that you submitted yesterday. Is there a specific ask in the letter that you have given to the department,
For the rate increases,
the rate increases?
Yes.
Okay. By a date?
December 1st.
Okay, thank you. Other questions? Senator Walls?
I thank you for being here, first of all. I heard you say 20%, but I did not hear what you were referring to. You said there was an increase or something of 20%. Was it to DHHS staff? or-
Yes, yes.
Okay, can you say that again, just so I can?
DHS whose children and family service specialists are receiving a 20% raise, effective November 1st of this year.
Okay. And then the other question was, when does drive time start? It doesn't start until you pick up the family. So a person has to work for free
Right.
until they get to the family, and then drive time starts. Is that correct?
We do get mileage,
Okay.
but that doesn't even cover the expense of the vehicle and the gas. And the drive time we currently get, I believe, is $18 an hour right now.
So it's $19 an hour when you have clients in the car, and then
Sorry,
once this.
sorry, you'll have to speak into the mic, but anyway,
Right.
we'll ask for that. Go ahead, please. You may go ahead.
Okay,
They can't transcribe people from the audience talking, so.
all right. $19 an hour once the children are in the car, but that was changed a few years ago. That used to be the same rate as our billable hourly rate. That was reduced, significantly reduced, which hurt our income as well. Even with the 2% raises, we're earning less now than we did in 2010 per hour.
Okay. Can I ask another question,
Yes, please.
Thank you. You have requested studies on rates for over 5 years and had conversations about rates. What's been the response besides, we'll do it, but have you had any other response from DHHS?
That sounds like
I
a
mean,
really good
why-
idea. We will do it. That will give us an average rate. Nothing's been moved on it.
Okay. And then the last question I have is, you talked about turning down cases. You said it's
Yes.
happening quite often now. What happens?
We aren't able to take the referral because we don't have enough staff or financial viability because we're going to lose significant amounts of money. So we want our staff to be on the cases that we can pay for.
And what happens to those cases, I guess? You can't provide the service, so then what?
HHS, according to Child and Family Services, will have their own workers do it. They're already overwhelmed. They don't have the availability or the hours to be able to do that as well. But that's the proposal.
All right. Okay.
But in other words, the families wait for services.
All right. Thank you.
Other questions? Seeing none, thank you very much.
Thank you.
Thanks for your testimony. Next, anyone that would like to speak on LR 184, please come forward.
Good morning. Chairman Arch and members of the HHS committee. My name is Matt Kosick, Mattkasik, and I'm the CEO of Region 5 Services. I'm here representing NASP, which is the Nebraska Association of Service Providers, to provide information on behalf of the intellectual and developmental disabilities provider community as it relates to LR 184. So I've been in my role since April of 2020. My predecessor, Dave Merrill, is now enjoying a much-deserved retirement. My organization, Region 5 Services, is the largest provider of DD services in Nebraska. We serve around 800 individuals with disabilities. We're based in Lincoln and have 22 locations covering southeast Nebraska. We provide wide-ranging services, including residential, day, and vocational supports. Simply put, we meet the needs of the individual so they can live their best life. Region 5 Services is one of the original 6 community-based service delivery regions in Nebraska, established in 1973. Before these regions existed, the only option for those with disabilities in Nebraska was to live in an institution. If you had a son or daughter at that time, you were told to send them to the Beatrice State Developmental Center, the BSDC. Today, most individuals with disabilities live full, meaningful lives within the community. They have social connections, jobs, and own cars. They have lives that you or I take for granted. It is because of DD providers that so many individuals with disabilities can achieve this. Today, the DD provider community is at a crisis point. We are struggling with the effects that COVID-19 has created on the labor market. Simply put, this existing system is not sustainable for providers. And if changes are not made soon, we could see dire consequences. The main problem that DD providers are experiencing is critical staff shortages. It's critical because our work does not stop. We must have staff to provide 24/7 support. Right now, Region 5 is recruiting to fill 61 vacancies. Because of this shortage, we have had to resort to drastic measures. We are overworking our existing staff while incurring high overtime costs. We are having staff work with multiple individuals at one time. We have foregone services such as vocational training. If someone we support lives independently or with parents, we don't send staff in. We have been forced to make decisions that negatively affect the people we are trying to build up. The most stunning problem is that most DD providers in Nebraska are turning away new participants. In this current budget biennium, funding was appropriated for roughly 500 new individuals to come off the wait list and receive services. Providers have been begging for this for years, and we are now forced to tell new participants to wait longer because we cannot find staff. The problem derives from our funding structure. Our service rates are determined by a cost-based analysis and then set by legislature. The most recent study was completed by DHHS in 2018 with data from 2016. While we are grateful that the Appropriations Committee and the legislative body has implemented 2% rate increases for providers the past few years, that simply is not enough for us to survive the current climate. As providers, we cannot increase our own rates. We can't just charge more like they do at stores. This is why we need legislative help. The solution to these issues is higher rates, which I'm aware is a request to the Appropriations Committee. However, we are at a point where quality of care is jeopardized, which is why this committee needs to be aware of the situation. The financial health of DD providers in Nebraska is dire. Providers have increased their spending to attract new workers, but again, there's no additional reimbursement to fund this increase. The handout I've shared shows data from 5 providers, which represents about half of the participants of DD services in Nebraska. These providers have experienced a 12% decrease in operating margin in the past 2 years. The additional staffing cost, coupled with a non-commensurate reimbursement rates, have led us to this point. This crisis warrants a mid-biennium adjustment to address these labor shortages. Our preliminary draft analysis shows that we need around 25% to increase provider rates, which translates to roughly $43 million in general funds plus the federal match. With needs as urgent as they are, an emergency appropriation would be justified. The model for our proposed solution can be found at BSDC. The state of Nebraska has just approved a 20% wage increase for workers there. Their work is very similar to what us providers do. In fact, we have a location in Beatrice where we frequently hire from the same labor pool. Now we will be forced to compete with a $17.62 starting wage while ours is $14.03. The reason they did this at BSDC was because they were at a point of crisis. They too had a critical staff shortage, and their administrators feared a catastrophic outcome. On behalf of all 5,000 individuals we collectively support, I urge you to help us prevent a catastrophe. Thank you to Senator Wishart for the introduction of this study, and I thank you for your time. I'm available for questions.
Thank you. Are there any questions from the committee? Senator Kavanaugh?
Thank you. Thanks for being here. You said that the 43 million plus the federal match, and is that based on the most recent FMAP calculation, or is it based on what it was previously? Because I know it's increased.
It was previous to that,
Okay.
based on current year numbers. This request is not tied to FMAP numbers at all. This is essentially to correct the system
Right.
moving forward.
I'm just wondering if there were a bill introduced, if it would actually be 43 million, or perhaps it would be less if the FMAP was higher.
I would suspect it would be 43 million because the FMAP funds are one time. So that would be
Okay.
my suggestion.
Okay, and has there been any discussion about utilization of the ARP funds, American Rescue Plan funds, to help with this? Is there an opportunity there?
The state division has worked on spending plans. However, it's been minimal thus far.
Okay,
It hasn't provided the help we've needed.
okay. But as far as you're aware, would there be an opportunity to utilize those funds?
Absolutely.
Okay.
Any bit would help.
Okay,
We could utilize one-time funds with regards to retention bonuses, new hire bonuses, just anything to kind of sweeten the pot to find employees would be beneficial.
I know that there's childcare grants as part of the American Rescue Plan, that childcare providers can do a pay increase for 2 years of something like $13 on top of, and I didn't know if that was the case for DD providers as well.
Not that I'm aware of.
Okay. I'll look into it.
Awesome. Thank you.
Thank you. Any other questions? Senator Walls?
Thank you. Thank you for coming today. The gentleman that came up before you had a list of contract changes imposed by DHHS and then an increased cost for providers. Do you have something similar to that we could maybe get our hands on?
Nothing quite like that. The provider community is so diverse. Our organization's a political subdivision. We have for-profit entities, we have nonprofit entities. So our best apples to apples comparison was operating margin. We're all kind of experiencing the same issues, but it's hard to calculate exactly what that impact is. And we felt this way was kind of the best way to start that.
Okay.
So,
All right, thanks.
Any other questions? Senator Berman?
Thank you. Thank you for testifying. Has the, I guess the Olmstead or final settings rule made it more difficult on providers to, or to retain employees, I guess, with those rules that developmental disabilities have to be out in the community so much and in vehicles so much?
I would say that it's one of many regulatory pieces that we work with. The regulations that we work within are constantly evolving. And so our staff and the folks we support are really good at adapting to change with that regard. I would suspect, and I would say that does not necessarily impact staff. If somebody is, if somebody's on the fence, whether they want to work for us or not, the content of the work doesn't, the content of the work is fairly similar with regards to that. It's the intangibles, the pay, if somebody can do something easier for more money, they're going to choose that. And that's what we're up against now.
Okay, I guess from my experience, I've heard that, having to be out in all kinds of weather and putting
Sure.
coats on, off, and all
That-
that kind of thing, it's
and that's-
very, very difficult.
Yeah, and that's part of, yes, I don't want to minimize that. Some of the regulations that have been in place have made it so lives become unnatural. Like, to set an arbitrary point where you have to be in the community for so long is just not what you or I would do. So that complicates it, but with regards to attracting employees, I don't think it quite plays into that. So,
Thank you.
Other questions? Seeing none, thank you very much for your time today. Thanks for coming and testifying. Anyone else that would like to testify on LR 184? Morning.
Good morning, Chairperson Arch and members of the Health and Human Services Committee. My name is Monica Gross, MONIKAGROSS, and I'm the Executive Director of the Foster Care Review Office. The Foster Care Review Office is an independent state agency not affiliated with the Department of Health and Human Services, the courts, or any other child welfare entity, created by the legislature in 1982. And our role under the Foster Care Review Act is to independently track children in out-of-home care or foster care, review children's cases utilizing local volunteer citizen review boards, collect and analyze data related to the children, and make recommendations on conditions and outcomes for Nebraska's children in out-of-home care, including any needed corrective actions. The FCRO is governed by a 5-member Foster Care Review Office Advisory Committee, which is appointed by the governor and confirmed by the legislature. Over the last several years, including 2021, the FCRO has made recommendations in its annual report that DHHS address the availability and accessibility of services across the state. Specifically, that DHHS established an effective, evidence-supported, goal-driven, outcome-based service array throughout the state to meet the needs of children and families involved in the child welfare system, to include the following: preventive services for neglect and substance use in collaboration with the Division of Behavioral Health and the Behavioral Health Regions, out-of-home services such as family support and parenting time services that have the least traumatic impact on children, stabilization of placements and recruitment of foster parents based upon the needs of the child and youth in collaboration with foster care providers, creation of treatment foster care services which actively engage families and would meet the needs of older youth, in-home supports for foster parents, especially relative and kin placements, mental and behavioral health services for children and youth in collaboration with the Division of Behavioral Health, and developmental disability services for children and youth in collaboration with the Division of Developmental Disabilities, and also enhanced services and case management for older youth. The FCRO is concerned about destabilization of the provider network in the rural and frontier parts of the state. We do not want to see a repeat of the situation in 2010 and 2011 when the availability of services in the northern, central, and western service areas in particular collapsed during and after the attempt at privatizing services and service coordination in those regions. If below market rates for necessary services lead service providers to exit the market, vulnerable children will be left without the means to heal from trauma, and families will not have the help they need to overcome adversity and reunify with their children. This will lead to increased lengths of stay in foster care for children, which leads to poor outcomes for those children, and those poor outcomes then follow them into adulthood. We simply cannot afford to lose more providers in our rural and frontier areas, and we don't want to wait until we have another foster care crisis or service provider crisis in order to address these issues. And from what I heard this morning, it sounds like we're facing a crisis in those areas. I've included some data from the FCRO annual report with my testimony. The data shows that there has been a 9.5% increase in the average daily population of state wards in out-of-home care from state fiscal year 20 to state fiscal year 21. These increases have occurred across the state, with the rural areas experiencing higher rates of increase than the urban areas. As a result, service needs for children, parents, and foster caregivers have also increased proportionately. Any loss of providers and/or services will add burden to a system that is already feeling the effects of market and labor forces out of their control, and will only increase the time children are in care, leading to delays in permanency. Thank you for the opportunity to speak with you today, and thank you for your concern for children and families in Nebraska, and I'd be glad to answer any questions.
Thank you. Are there questions? Seeing none, thank you very much for your testimony.
Thank you.
The next testifier for LR 184. Good morning.
Good morning, Chairman Arch and members of the Health and Human Services Committee. My name is Brian Shanks, spelled BRIANSHANKS, and I'm the Chief Financial Officer for Tabitha Healthcare Services in Lincoln. I'm testifying today on behalf of Leading Age Nebraska. We want to first thank Senator Wishart for introducing this study resolution. Tabitha, Nebraska's largest mission-focused nonprofit, offers Nebraska's first and only comprehensive line of senior care services. Through results-driven rehabilitation, accessible at-home healthcare, innovative living communities, and compassionate hospice services, Tabitha provides 5-star senior care in 27 Nebraska counties. Our main campus is located in Lincoln, and we offer community campuses in Lincoln's Williamsburg neighborhood and in Crete. We also have regional offices in Grand Island and York, serving clients from Kearney to Nebraska City. Medicaid reimbursement is a significant source of income for Tabitha and will remain so as long as we are able to serve that population. The current rate reimbursement structure puts many of these services at risk, simply due to the fact the reimbursement does not cover the actual costs of providing care. Currently, we lose around $40 a day per Medicaid bed. As the cost of services has outpaced rate increases provided by the department and the legislature, that's a cost shortage of almost $15,000 per year per Medicaid patient. This is simply not sustainable and not fair to those who are paying for care with insurance plans or family resources. They get to make up the $40 gap for their neighbors. At Tabitha, we fundraise hard and are fairly successful at it. We have a separate foundation board that works very hard at helping us pay the bills and provide the highest quality care for our residents and customers. This is not the case for most facilities in Nebraska. However, and it's getting harder and harder to find homes for aging Medicaid eligible Nebraskans. Over 40 nursing homes have closed in Nebraska in the past 5 years. While census is a factor in some rural areas, the vast majority of them have simply gone broke, lacking the ability to close the gap between cost versus reimbursement. Just to give you an idea of some information for Tabitha, our average daily census for Medicaid is 55, which translates into a roughly $800,000 gap, annual gap, which we have to fundraise for, or other revenue has to help cover those costs for the Medicaid clients. Home health care, as an example, which has grown tremendously during the pandemic, the Medicaid reimbursement rate is $25 per visit. Well, if I send an RN, the wages and the benefits is $50 for that visit. Census in March of 2020 from up to today is now down 25% due to the pandemic. So we don't have the other revenue to help pay for the Medicaid clients. The staffing shortage is brutal. Clinician staff availability is just not out there. And it's caused pay rates to escalate up to 30%. Supply costs have also increased dramatically. The cost to support care for our clients is mainly labor and supplies. And so those costs have just gone up tremendously. Support services such as medical software that helps us keep track of our patients that's required is up 6 to 10%. Inflation is a problem for all of us. I think we all know that. And the provider relief funds that have helped us tremendously get through 2020 and 2021 are now pretty much gone. So 2022, 2023 is a major concern for Tabitha. Thank you today for letting me speak, and I'm available for some questions.
Are there any questions? Senator Berman.
You talked about the employee problems with attracting and retaining employees. Will the vaccine, is there going to be a vaccine mandate, or will that affect?
The CMS, which mandates, rules and regulations for care for senior healthcare, mandated vaccination for all staff. So we have that mandate.
Do you have any idea of how many employees you'll lose because of that mandate?
We lost approximately 75 employees this month.
So what percent would that be? That you
That's
lost
about
75
10%.
this month?
That's about 10%, a little over 10%.
Thank you.
Other questions? Senator Kavanaugh.
Thank you. I was just trying to do some quick math. So you have 55 Medicaid
Average daily census.
daily census, which equals 800,000 gap a year.
Mhm.
So does that work out to be about $40 a day?
Yes.
A person.
We're short about $40 a day to cover the cost.
And so if that were to change, if the Medicaid reimbursement rate were to increase by $40 a day, would that help with your workforce shortages, or would that just keep things home that hold them harmless?
That's a great question. It depends on what happens with the labor market. Right now, it's so unpredictable. The staffing shortage just seems to continue, and the rates just to keep going up. So, I mean, if that were to stop, it would definitely help us, and we could make it at that level.
So would that bring you up to the level that you charge for non-Medicaid patients?
It would be very close, not quite, but it would be very close.
Okay. And so, and forgive me, I'm not well versed in this. So you're a nonprofit.
Yes.
Are most nursing homes nonprofits then?
No.
If they
It's
take
about half
Medicaid,
and half.
if they take Medicaid patients, they almost have to be a nonprofit to raise money to fill that gap?
Most likely, yes.
Okay, thank you.
Other questions? Seeing none, thank you very much for your
Thank you.
testimony. Next testifier for LR 184. Is there anyone else that would like to testify for LR 184? Seeing none, Senator Wishart. Oh, I'm sorry.
My name is Joey Letourneau. JoeyLetownowicz. Thank you, Chairman Myers, and members of the committee. I want to present an analog I'm an analog of this situation here. I was getting my care through a home health agency, and they no longer could afford to take Medicaid patients. Now, DHA just said, give a 30-day notice, and that's like half a day. I mean, if you give a 30-day notice to this population to find new people, I mean, that's like giving like 5 minutes, 5 minutes, here you go. And so all these people were dumped, into the patient pool, and there's simply not enough labor, and rate increases have to be made to attract people that are willing to just might tip them over the edge, as opposed to Chipotle or that kind of thing. Because it has real effects. I was lucky because personally I had my health aide, my primary, she came over with me. I mean, she became like a sister. It's kind of strange. So she came over, and I still have a couple of visits I can't fill though, that I have a couple aides. One was my ex, she does it. And so I was lucky, but there are people, but I still have to, some days I have to schedule my aid, so it's hard to exercise. It's hard to do a few things I have to exercise. It's a part-time job. If I want to keep any mobility at all with my particular chronic illness, then I have to spend a few hours every day, so I need that. And then I'm still waiting on a couple of visits where I can't have it filled. And everybody's kind of scurrying around in my market. I can't imagine, the foster child. Something's got to be done across the board because this particular pool that I'm concerned more about than myself is definitely as another remora on the fish. We're just sucking from the labor pool, of the foster. So that's it. And thank you.
Thank you. Thank you for your testimony. Are there any questions? Senator Kavanaugh.
Thank you. Thanks for being here. So you said that you lost your home health aide,
I lost the company.
the company. Okay.
Right, so then you have to scurry about and find someone else. Now, for me, my aide was so good and I had a good relationship that, I just called the other place and say, you can hire her, and that's no problem. And so it was, for me, it was very easy because she came over and I had another support. That's kind of miraculous, that's.
So did the home health company that you had, did they go out of business or?
No, they just simply couldn't afford the Medicaid.
Okay, I see. They
And,
couldn't, yeah.
So to save everything, that was the claim of the person, the owner, and I've talked to him a few times, and so I don't doubt that claim.
Yeah.
because-
So the reimbursement rates didn't cover their costs to
Yeah,
service you.
right, and then with the imposition of EVV, electronic verification, that's just been a colossal disaster for the kind of rather minute administrative structure within these agencies to deal with all that. And then that's been a significant drain on resources. And this is just something that, DHH kind of, in my opinion, dumped on without having it, thought through. I have an EBT. I make a minimum, $15, and I try to use the site, and sometimes I can't get it, sometimes I can, but then you can't get the arrow you have to actually, hit the 3 lines to get rid of it. It's hysterical. It seems like everything, that's given to for us to use is flawed in some way. That
And I have just one more question.
Sure.
When was this? When did this happen that you were notified? How long ago?
Okay, that was earlier this year. I'm bad with spans of time. Several months ago.
Okay.
March. Yeah.
That helps. I just was curious if it was very recent or it was earlier in the year. So thank
Right,
you.
and they're still having trouble with finding me a couple. And I told them, don't worry so much because, I've got, but I still can't get it, because other people, need it.
Thank you.
Senator Merman.
Thank you for testifying. I assume that you are able to live at home full-time.
Right.
Is there any rules that you know of as far as how often you have to be outside or in the community or anything like that?
No, if I wanted to, I could stay inside all the time, or I can go out just, if I want.
No rules, and
No.
thank you.
Right.
That's good.
Any other questions? See none. Thank you very much for your testimony today.
Thank you.
Is there anyone else that would like to testify for LR 184? See no one. Senator Wishart, you're welcome to close.
Well, thank you so much for listening to this hearing. I'm happy to follow up with further discussions. As you can see, this is an issue that is growing to kind of a crisis level, and so it is something I would like us to work on in the next session. And so happy to work as a member of the Appropriations Committee with this committee, and happy to take any additional questions you may have.
Are there any other questions?
Can I have
Sure, Senator Walls.
Thanks, Senator Wishart. And if you don't know this answer to this question, that's fine. But do you know Nebraskans pay in to Medicaid that's deducted, from their paychecks? Do you know that?
Oh, I don't know that.
All right, that's fine.
Senator Kavanaugh.
Thank you. Thank you, Senator Wishart. I apologize, I missed your opening, and so if this was already covered. But I appreciate that Foster Care Review Office was here, but did anybody from DHHS give any input into this or any reflection or thoughts on this?
The department didn't come today, but we do work pretty closely with them on rates. It's something that our committee has worked over the last 6 years in appropriations side on trying to get the rates to a level where we're not seeing this significant turnover, in particular in child welfare and in developmental disabilities. And one of the things the department did well was really start to work on increasing DD rates. And so that's something that, again, we're going to need to continue to do there, but also with child welfare. And a lot of this stems back to when we were hit with $1 billion revenue shortfall and everybody was asked to tighten their belts. But the cost of doing business didn't tighten. And so we're seeing this just growing gap.
I was just hoping to find what they thought we could do to help address the situation. So thank you.
Any other questions? Senator Berman.
Thanks for being here and bringing this study. We had one testifier testify that they were going to lose 10% of their workforce because of the vaccine mandates. And you know what? We know that these people are in desperate times already because of not being able to have enough employees. Do you have any idea about how much more dire that situation will be with vaccine mandates?
I mean, what I have heard from senators who represent rural areas in terms of some of the requirements that are coming down on the federal level is that there will be issues with employee retention when there are already workforce issues. And so that is something as a state that we're definitely going to have to look into next session.
Yes, I've been hearing the same thing. It's going to just make the situation so much worse and already has. Thank you.
Any other questions? Seeing none, thank you very much. This will close the hearing for LR 184. And we will open the hearing for LR 207.
Great.
Senator Moorfield, you're welcome to open.
Thank you, Chairman Arch. Members of the Health and Human Services Committee, for the record, my name is Adam Moorfield. That's ADAM, MOR, F as in Frank, ELD, representing the Fighting 46 Legislative District here today to introduce LR 207. I introduced the LR 207 at the request of a constituent here today to testify. The purpose of this study is to look at making pre-exposure prophylaxis or PrEP medication easily accessible to individuals that are at a high risk of contracting HIV. In some cases, to allow licensed pharmacists and clinicians the ability to prescribe and dispense such medications in a timely manner to those who qualify and need it. PrEP meds have been found to be 99% effective in preventing HIV infections. As a result, several states have enacted legislation to address access to this preventative measure, including California, Colorado, and others. Other states have enacted legislation to create more public awareness around these availability of this life-saving drug. I do want to note just a few different things and research in what other states have done. Just a few paragraphs here, but it'll give you an example of what we're looking at. So in 2020, Georgia enacted House Bill 793. This creates a 3-year pilot program for the purpose of providing PrEP drug assistance to individuals who have tested negative for HIV, but who have high risk factors that expose them to HIV. The program is open in specific counties identified by the CDC for being at risk of outbreaks of HIV as a result of opioid use, or other counties identified as being at risk by the state health department. Another example is in 2019, Washington enacted Senate Bill 5602. This required the Department of Health to develop recommendations for increasing awareness about the financial support that is already available for individuals who could benefit from a PrEP prescription. And finally, Alabama in 2018 enacted House Joint Resolution 183. This joint resolution recognized HIV Awareness Day, and then also encouraged Alabamans to increase their awareness and understanding of HIV and participate in prevention efforts, including building awareness of and expanding access to PrEP. So those are just a few examples, and today we'll hear testimony from several individuals who will share insight into the need of Nebraska to enact this type of legislation. I'm happy to answer any questions, but I think that there will be testifiers behind me that'll probably have more information on this life-saving drug and ways that we can help promote the use of it.
Thank you. Are there any questions? Seeing none?
Great.
Thank you. Will you be staying to close?
I may.
Okay.
Yeah.
All right.
I'm planning on staying. I may or may not close.
Okay. All right.
Thank you.
First testifier, Luke Peterson. You can go ahead.
Okay. Distinguished members of the Health and Human Services Committee, my name is Lucas, but you can call me Luke. I'm here today to talk to you something very personal for me, and it's taken me years to get to this point to where I'm at today. I also want to take you back to the beginning for me because it's helpful to know where to start. I come from rural Nebraska, but I currently reside in Lincoln. Senator Moorfeld is my state senator, and I thank him for sponsoring this resolution. Been living in Lincoln for 15 years or so. Should disclose that my testimony is not representative of any organization I may belong to. I also want to be clear that my commentary isn't a direct response to the failed effort to have comprehensive sex education for all of our public students. That's not a point I intend to make. I'm just sharing life experiences. I grew up in a very conservative area of Nebraska, and because of that, as a child, I felt as if there was a sense of being sheltered from issues that seemed like quote unquote big city problems. Hardly could be correct in retrospect because HIV doesn't discriminate like people do. I was not aware of what HIV was when I was living in Phelps County until I was like in 5th grade. It's a very small community where I come from, and at the time, children never ceased to stop gossiping after public school closed down and you're taken to the church for confirmation class. Can only imagine that's true today. Like all good and God-fearing children, I was in confirmation class when I learned what HIV meant, because there was someone new to me in town, but was evidently from Bertrand originally. This man was a grown adult who moved back to his parents' place because he was sick. I was flummoxed because I thought I knew of everyone in the community, but that wasn't so. Me being the curious person, I whispered, what's his name? In a whisper back, we don't call him by his name because that's God's punishment for what he has. He's just the man who has AIDS. I was 11 or 12 when I learned about the stigma of HIV denies you God's love in some people's opinion. Fortunate for us, I'm not the best Christian today, but I knew that I'm gay when I was that young, and no one in my life told me that it was okay to be different. I vaguely knew that it was a possibility for me to get HIV because I'm gay. I was terrified for myself if I ever got it. Thanks to the classmate who said that to me, I learned to be dishonest. By the way, the man who moved back to his parents' house, his name was Tom, and he did die in his parents' care. Suffice it to say, I start finally living my honest and best life when I was free from the small negative influences of rural Nebraska. Was also self-learning in college about what HIV and CDC recommend, or HIV and what CDC recommendations for testing was. I thought I was invincible when I was much younger, and I was 25 when I tested positive for HIV, and I still remember it like it was yesterday. It's perhaps the lowest point in my life that I've ever experienced, and I did my crying in the seats earlier, so hopefully I don't do it now. I'm 37 today. I have an undetectable HIV status, and what that means, you literally have to suck every bodily fluid out of me in order for you to be considered at risk. And a lot of people don't understand what HIV undetectable status means. So there's a lot of misinformation about people dying of AIDS, but when you're literally living with HIV. I was really frightened beyond belief in those early days, to the point where I was agoraphobic and would cry accidentally when I cut myself. I didn't tell many initially because I was so ashamed, but fortunately for me, I had my friends and family to come help. Not many people are that lucky. A lot of people don't have the safety nets that's needed for them. And I know of people who have committed suicide because of an HIV test. I'm asking the legislature to sponsor a bill that is actually a bipartisan effort from presidential administrations that would helpfully create and envision an AIDS-free generation for the future. It's something that started with George W. Bush and continues to be supported by President Biden today. Many states have taken their own initiative, and I know that a neighboring state, Missouri, has done something similar recently. I'm not a doctor or clinician in the field of HIV care or a social worker, but you're going to hear from people who are very knowledgeable in those respects. So I would urge for your support, and I would gladly answer any questions.
Thank you. Are there questions? Senator Kavanaugh?
Thank you. Thank you for being here, Luke, and for sharing your story. I just, more than a question, just wanted to say thank you so much for your bravery. And I'm sure that this wasn't an easy thing for you to come and do, and it's very much appreciated and valued. So thank you.
Every time I get the opportunity to talk about my status, I feel like it's an opportunity to educate others. So thank you for the
I have
opportunity.
definitely learned from you this morning.
Other questions? See none. Thank you for your testimony.
Good morning, Chairman Arch and distinguished members of the committee. My name is Stephen Jackson, STEPHEN JACKSON. I am a former DHHS employee. I know that DHHS is not here today, and experience tells me why we're not allowed as state employees to testify in front of the legislature. We're allowed to provide information. But as a former state employee in public health with a master's degree from UNMC, I know for a fact that the CDC and states around us, including Iowa, have promoted the use of PrEP as a prevention mechanism against the transmission of HIV and AIDS. When I was about 25, I learned that I was HIV positive. Had PrEP been available, I don't know that I would have had the opportunity or the knowledge or fortitude to go out and get it. We now have social media. We have an agency, Nebraska AIDS Project, that does advertise in social media around the use of PrEP to prevent the transmission of HIV and AIDS. It is not just one population disease. You will also hear from a heterosexual woman who will talk about her transmission. PrEP will prevent the transmission of HIV and AIDS from anyone who has access to it, and having access is really what this is all about. So I didn't prepare anything. I'm just speaking from the cuff. I appreciate the opportunity to be here before you. If you have any questions for me, I'd be happy to answer those.
Thank you. Are there questions from the committee? Senator Kavanaugh?
Thank you. So you have a master's in public health,
Yes, I do.
and I'm not super familiar with PrEP. So could you maybe explain to us a little bit more about when you would take it and why you would take it?
Okay. So pre-exposure prophylaxis is what PrEP is. And essentially, it's taking one of the current HIV medications prior to sexual activity. The best preparation is to be on the medication for at least 7 days, taking it consistently throughout your life, as long as you're sexually active. In use with contraception, condoms is the most efficient way to prevent the spread of HIV and AIDS. But exposure to bodily fluids during sex is then prevented. The use of PrEP then prevents the spread of HIV and AIDS up to 99%.
So it's something that you would take sort of like you would take, well, you wouldn't, that I would take as like a birth control pill.
Correct. It
Okay.
would be a daily.
It's a preventative, not a, okay.
Correct. There's also post-exposure prophylaxis when someone is exposed to bodily fluids, like a nurse or a healthcare provider who's been exposed to HIV. That is post-exposure prophylaxis.
I was just trying to get clarification on the need for it to be something that you can get over the counter versus if it's something that you are getting in advance of having sexual activity.
Okay.
Yes. Now I understand.
Okay.
So thank you.
Yes. And it is a prescription-based medication.
Thank you.
Thank you. Other questions? See none. Thank you for your testimony.
Thank you.
Next testifier for LR 207.
Good morning, members of the Health and Human Services Committee. My name is Tommy Dennis, TOMMYDENNIS, and I come to you to share not only my lived experience, but my professional experience. I come to you as a representative of the Nebraska AIDS Project, where I currently serve as their outreach coordinator. For those of you who do not know, Nebraska AIDS Project is the only AIDS service organization in the state of Nebraska currently serving Omaha, Lincoln, Scottsbluff, Kearney, and Norfolk. I also identify as someone who is living with HIV and has been living with HIV for the past 11 years. In support of making PrEP readily available, what I can say is from my personal experience that although my diagnosis came 2 years prior to the FDA approving PrEP, that had I had that access, then I think my life would have taken a very different course. Pre-exposure prophylaxis, which is commonly known as PrEP, is a once daily medication that's taken orally by individuals who are HIV negative and to prevent HIV transmission. Before beginning PrEP, individuals must take an HIV test to ensure that they are HIV negative. And while taking PrEP, they must continue to be under the care of a healthcare provider every 3 months for follow-ups, HIV, and other lab testing to discuss their prescription refills. In 2021, Nebraska AIDS Project has already served roughly 123 individuals through our PrEP operations in Kearney, Lincoln, and Omaha. In our communities, PrEP can be confusing and a complicated process, more complicated than simply going to a primary care physician for an annual prescription renewal. At Nebraska AIDS Project, we strive to make PrEP easy and affordable especially to underserved communities, such as individuals without insurance, Black and Latinx individuals, as well as young people. The CDC research that has found that while 2/3 of people could potentially benefit from PrEP are Black and Latinx, they only account for the smallest percentage of prescriptions to date. At Nebraska AIDS Project, we have expert PrEP navigators who help these clients assess their insurance needs, schedule ongoing laboratory appointments, and provide ongoing education and adherence support regarding their PrEP use. NAP offers these PrEP services at no cost and in a way that best meets individual needs. We pride ourselves in connecting interested clients to PrEP in a speedy manner, many times providing on-demand HIV testing and PrEP clinic scheduling, resulting in same-day PrEP access. We at Nebraska AIDS Project PrEP operations, while mighty, are very small, and that is one of our biggest challenges in expanding the awareness to access. We especially want to increase access, again, within our Black and Brown communities, as well as our young people. And the truth is, the process for accessing this prevention medication doesn't need to be difficult. It starts first and foremost with education. Education regarding the sex ed standards, comprehensive sex ed standards, which has been tabled, but I won't go into the weeds of that. But that definitely is an element that needs to be taken into account. Other communities have successfully dismantled barriers and systems of oppression. For example, under Senate Bill 159 in California, pharmacists are authorized to dispense PrEP without a prescription, permitting them to administer 30 to 60 days of medication after testing and counseling. Additionally, the law directs pharmacists to connect individuals to physicians for long-term care. In 2016, a Colorado law allowed for minors to consent to PrEP without the consent or notification of a parent, integrating services in a model that matches modern STI prevention practices. Although the annual number of HIV diagnoses in the United States has decreased from 2011 to 2015, the number of diagnoses has not declined among our youth. The studies are clear that when taking PrEP every single day, PrEP is 99% effective at preventing HIV infection through anal or vaginal sexual activity, and at least 74% effective when exposed to HIV injection drug use. Increasing accessibility to PrEP decreases HIV transmission rates, a critical need in our hardest hit communities. In 2021, Black and Latinx races represented 4.8% and 10.9% of the total population respectively, yet the proportion of Black and Latinx individuals newly diagnosed with HIV, which was 19% for Black and 36% for Latinx, and living with HIV, 23% and 18% respectively, was significantly higher than each race's overall proportional representation within the Nebraska population. Health disparities like this can be improved through support of bills such as LR 207. I want to thank you for your time, and I'm happy to answer any questions you may have.
Thank you. Are there any questions? Senator Berman?
Thank you, and thank you for testifying. How expensive is PrEP?
So PrEP can, without insurance coverage, PrEP can be upwards of $1,500. However, there are programs that we have made available to reduce that cost to as little as free.
So $1,500 annually or?
Monthly.
Monthly, okay.
For 30 days.
And do most all pharmacists have that available?
Most pharmacies do have it available. Right now, we are contracting through Walgreens Specialty Pharmacy to provide that.
Could I ask one more?
Yeah, sure.
I think you mentioned, I think it was California provides it with counseling.
Mm-hmm.
So who does the counseling? Does the doctor do the counseling?
So the counseling can be facilitated either through a medical doctor or a licensed nurse practitioner.
So if they do the counseling, couldn't they also write the prescription?
Yes, and that's actually that's the direction that Nebraska AIDS Project is trying to go in. We have a volunteer medical doctor who helps us run our PrEP clinic, and we're currently in search for a nurse practitioner to help us expand.
So I thought this hearing was about not mandating prescription for access to PrEP.
That is correct. My point is that while that is a mandate and that's the guidelines that have been made been set out, we want to try to reduce those barriers to make it more accessible. So it's not just a medical doctor or a nurse practitioner who can provide access to those medications.
Well, okay, thank you.
Thank you. Other questions? Seeing none, thank you very much for your testimony.
Thank you.
Next testifier for LR 207.
Here's my green paper.
Welcome to the Health and Human Services Committee. You can begin your testimony.
My name is Cindy White, Cindy White. I must say that I cannot pass an opportunity to say to someone who is transcribing that I am a 60-year-old grandmother. I say that purposely because my birthday is this month and I'll turn 61, and that makes me feel really old. I'm also glad to be here today. I'm representing a community of women who are disproportionately impacted by HIV transmission. I speak from my own experience. All but 7 years of my life have I lived in Omaha, Nebraska. I was born and raised here, and those 7 years that I was not here were in my early 20s when I moved to Denver and moved back shortly after I had a child, my one and only son, Jacob, in 1987. I say that because in the way of history, I contracted HIV sometime in that early 20s when I thought I was at no risk to get an STD, because even though I was in an epicenter, Denver being kind of one of those hot spots, I wasn't having sex, I didn't think, with what was described as the people getting this disease. Unfortunately, HIV does not discriminate. I have a sweatshirt that I received in 2002 that basically says AIDS doesn't discriminate, people do, on the back. It was part of prevention messages at that time to just get people to test, to slow down the rate of infection here in Nebraska. It was fairly successful in that it targeted a younger demographic. I admit, with my white hair, some of it now pink, I am not the one who can usually talk to a young person and say, hey, here's what you need to do, keep yourself safe. Did you ask your partner how many sexual partners they've had? Have you yourself been tested for an STD? For 20 some years, I was doing HIV education and impact in the Millard school system. I spoke to every 8th grader that showed up the day I was there in Millard, in the 6 respective middle schools there. The idea of giving comprehensive sex education is not a matter today of this committee or of this session, even though I would be happy to give my 2 cents worth there. What I can say, though, is PrEP is something that this state cannot do without. As someone who talks to people all the time who are newly diagnosed with HIV, it makes me sad to think that Nebraska would pass an opportunity to get some of that federal funding, if nothing else, and to implement a way that people can easily get from the point of, oh my God, I just had unprotected sex, I wonder, to the point of now I know for sure I'm HIV negative, and now I know what to do in the future to protect myself. As a straight woman who received body fluid in order to get HIV, I feel it's mandatory that Nebraska Department of Health and Human Services look at an opportunity that, again, we will be at the back end of the bandwagon if we're not careful in the next year or so. Other states have seen the beauty of this intervention. I look at the numbers every year of HIV transmission in Nebraska. Around 88 to 100 people every year still contract this disease. That makes me sad for the mothers out there who might have to say goodbye to a child, or a mother who might have to say goodbye to a lover. I unfortunately did not know of my HIV status when I met Dan in August of 1990. I was short of being 30 years old, and then got a telephone call from my ex-husband from another state who alerted me to the fact that he had HIV and it tested positive. And basically, I was the one who gave it to him, he said. After I hung up the phone and freaked out for a good 15, 20 minutes, I called Dan and said, "What do you think?" And he said, "The only way you'll know is to get tested." And I did. You know, you would be sitting with me here today if, in fact, HIV didn't ravage his body before he passed away in my arms December 26th of 2001. I'd like to think that I would have been one of those women who would have heard the call that it could possibly be me that was the one living with HIV. Well, I know I could have spared at least his life. I could see that if PrEP were an option and I could have gone into a local pharmacy, I trust the pharmacist there to give me a vaccine. If I could go to my local pharmacy and say, "Here's a situation, I would like to investigate getting PrEP," that pharmacist could take me into another room, give me a rapid test for HIV, where I knew the results of the test in 15 minutes, and then I could receive PrEP right there, point of purchase from the pharmacist. The paperwork could be completed in a short period of time, and within a certain amount of time, I could start feeling like I was part of the cure or part of retaining my future, even maybe my ability to have children in the future, by doing the right thing and receiving HIV PrEP. Prevention
Ms. White,
is cure.
your red light is on.
Thank
If I
you.
could ask
I
you,
will.
you can have some concluding comments if you'd like.
I appreciate that. One thing I'd like to say in closing is it costs a lot to treat someone with HIV. I've been HIV positive since 1990, diagnosed, and I've since lost my eyesight due to complications. We are concerned about the $1,500 maybe a month, most of which gets paid by insurance, but I take a medicine now because I don't see light that's at the tune of $24,000 a month. So there are complications of HIV that I think should be taken into account when we're making decisions about PrEP in the future too. Thank you.
Thank
If
you.
anyone has a question, I'd be happy to answer.
Are there any questions from the committee? See none. Thank you very
Thank
much
you.
for your testimony this morning.
Thank you.
Is there anyone else that would like to testify on LR 207? See none. Senator Morfeld, you're welcome to close.
I'll make my closing very brief. I hope everybody learned a lot today. I know I did. And I'm happy to work with the committee next session to look at some ways that perhaps we could increase the accessibility of this type of medication, or at the very least, increase awareness of certain programs. Because it could save a lot of lives. And in the end, as the woman just testified before me, it also could save a lot of money too. But I think lives are the number one concern in my opinion. But I think it's also cost effective. And I think that's important to remember. So with that, happy to answer any questions.
Thank you. Are there questions? Senator Kavanaugh.
Thank you. Thank you, Senator Morfeld, for bringing this. I did learn a lot. I didn't really, I think I've seen TV commercials advertising this drug, but I wasn't really familiar with it. And Ms. White's testimony was very eye-opening as a heterosexual woman to hear that. So I appreciate that. So what do you view as the best next steps for this drug?
Well, I think, in an ideal world, we would increase public education at the state level. And then also including public education, I think that we should look at some opportunities to leverage federal funding, which sounds like it's out there. I need to, quite frankly, research that a little bit more after this hearing and make it so it's more accessible across the state. It sounds like we have a good program in Omaha. And I know that they do work throughout the state. I think it's the Nebraska AIDS Project. But that being said, there's only so much education and there's only so much resources when it comes to the nonprofit work. I do think there needs to be more education and resources within the Department of Health and Human Services and the services they provide throughout the state. So to answer your question, that's a long way of saying, I think we need to look at a more robust public education campaign. And I think that we need to look into the federal funding opportunities that we can leverage to make it more accessible to more people.
Thank you. I am interested to learn what the federal funding opportunities are as well. So I'll probably follow up with you on that.
Yeah, I'll do some research. And if other people want to do research, then we can come back. I'm hoping to figure out which direction we want to go with this in December for the session.
Thank you.
Other questions? Senator Day.
Thank you, Senator Moorfield, for bringing this. So my question would be a follow-up to Senator Kavanaugh's question. There was some testimony about, looks like California, New Jersey, and Missouri have laws where at-risk populations can obtain things like PrEP without a doctor's prescription for an emergency situation. So currently in the state of Nebraska, PrEP is only available with a prescription. Is that where we are? Or sometimes not even then because it's too expensive or
My understanding right now, and I might be corrected, immediately behind me, but my understanding is that it requires a doctor's prescription right now. And the way that I would like to make it is much like what we did with naloxone. Naloxone helps reverse the effects of an opiate overdose, so it restarts the heart, breathing, all that stuff. Legislation that I brought several years ago made it so that naloxone was made available over the counter by a pharmacist rather than having to wait for a prescription. So makes it much more accessible. Family members, other people have much greater access to it.
Okay, wonderful. Thank you.
Yeah.
Other questions? Seeing none?
Okay.
Thank you,
for the
Senator
time.
Moorfield. This will close the hearing on LR 207. We will open the hearing on LR 198. Senator Hunt, welcome.
Thank you.
You
I'm so
may-
excited for this hearing.
You may open.
Good morning, Chairperson Arch and members of the Health and Human Services Committee. I'm Senator Megan Hunt, MEGAN-HUNT, and I represent District 8, which includes the neighborhoods of Dundee and Benson in Midtown Omaha. I'm eager to have this discussion today about LR 198 because this is an opportunity for us to right a wrong and provide long overdue justice for current and former Nebraska youth in state care. Earlier this year during our regular session, I was on my drive to work here from Omaha and I was listening to NPR and I heard this story about a national investigation that was conducted by NPR in collaboration with the Marshall Project, which is a nonprofit news organization covering the U.S. criminal justice system. In this story on NPR, they were talking about how there's this practice that most states, 36 states have been doing that's kind of flown under the radar for a long time, which is now coming to light and more states and more lawmakers are talking about it and starting to scrutinize it and ask if it should be changed. In a nutshell, what's happening is that states, including Nebraska, are intercepting Social Security dollars that belong to foster children and reimbursing itself for the cost of their care. This story was really gripping to me as I drove in, and I think it was to anyone who heard it. And I immediately texted my staff, and they were listening to the same story too. And Many people from the advocacy world were texting me saying, are you listening to this story on NPR? The state is taking foster kids' money. And like the gut check there was so bad. Like it sounds awful. And so I'm thinking, well, there must be some history to this, especially given that so many states are doing it. So let's find out what this is really about. So the story was really impactful. It stuck with me ever since I heard it. And even still, when I'm canvassing or talking to folks in my district or whatever, and I bring up what I'm working on in 2022 and I mention this issue, so many people tell me that they also heard the story and they remember it and they were shocked by it. So this is something that's definitely kind of at top of mind for a lot of Nebraskans right now. My staff and I agreed that day that we wanted to do an LR to investigate this and get it on the record and do some digging into the issue and see if we could do anything to fix it, if we needed to, if it was called for. And I'm sending around a copy of the story. There's a lot more reading you can do online if you want to do some Googling yourself. But I would really encourage you to read about this and see if it strikes you like it did me. I won't describe everything that's gone on nationally, but I will keep the focus on how we do things in Nebraska and what our specific solutions for our state and for our youth might look like. But just know that generally lots and lots of states are looking at legislation around this to address it in some way. So I think it would be good for Nebraska to kind of get ahead of it. Basically, most states that do this hire a contractor. In Nebraska, our Department of Health and Human Services contracts with this Virginia company called Maximus, and they've worked with them for some time. And I know that Maximus is one of the most prominent contractors doing this work in other states as well. I believe there's a representative from out of state to be with us today, so I very much appreciate their willingness to talk. The contract is set up with the goal of identifying state wards that might be eligible for Social Security benefits, apply for the benefits on the youth's behalf, pay a cut of those benefits to the contractor, Maximus, and then retain the youth's money as the representative payee without the youth or their guardians or legal representatives' knowledge and without any due process for appeal. So in this case, we're talking about children in the foster system who could be eligible for Social Security benefits. And the reason they would be eligible for benefits is because they have a physical or mental disability, or because they have a parent who has died or who is disabled. So we're talking about the most vulnerable kids in our communities, foster kids, but then like the most vulnerable of the vulnerable kids with the disabilities or who have lost parents, things like that. These are also referred to as disability and survivor benefits, or SSI and SSA respectively. And the way they are applied for and administered is a little bit different, but for the purposes of this LR, we've lumped SSI and SSA together as a total amount of Social Security benefits that the state is essentially taking from youth without giving them or the adults responsible for them a meaningful opportunity to understand how to challenge that or get any due process to appeal that. It's a very untransparent system, and I don't think that's good governance. So what's happened here is really striking, and I don't agree with what has gone on, but I think that the vast majority of folks that have had a hand in this over the years have been following directives from higher ups. It's been the status quo, it's the way things are done, and it's kind of an unintended consequence of federal policies that created an environment to allow this to happen. But we would better serve the people and be better stewards of these children if legislators could shed some light on the process and put more accountability and transparency into it. At the very least, I think that kids and their guardians should know that this is going on. The impact of this on youth may be immeasurable, but from national probes into similar practices in other states, there are many testimonies from former foster youth talking about how having this Social Security income money would have made all the difference in setting them up for success as they navigate their independence. There's all kinds of data about how youth aging out of the foster care system without permanent families are more likely to experience homelessness, unemployment, and incarceration. One statistic that jumped out at me from a longitudinal study of youth aging out of foster care across the Midwest from the University of Chicago is that over a third, 36% of youth aging out of foster care experienced at least one episode of homelessness lasting 1 month or more by the time they turned 24. Another study showed that foster children suffer PTSD at twice the level of US war veterans. There's plenty more startling data like that, And when I introduce a bill, we can get into more of it as well. My office, advocates in Nebraska, we spent considerable time, all year really, trying to find foster youth to come forward and testify today. But due to the nature of this practice in our state, most foster youth and the adults responsible for them don't even realize that this has happened to them. They don't even know this is happening. According to DHHS in Nebraska, this impacts somewhere around 400 foster youth a month over the past 5 years, generating about $2.7 million a year for the state by taking the SSI benefits from around 400 youth per month. But because of the way this is implemented, we struggled to find testifiers because we don't know who they are and they don't even know who they are because they're not informed about it. No one's informed that these benefits are being taken. There are thousands, if not hundreds of thousands of adults probably still living in Nebraska who have been affected by this, and they may not even know it because according to DHHS, this has been going on for at least 20 years. Overall, I think we can all understand that $700 or $800 a month can mean the difference between getting a first apartment or going to college and ending up on the street. The transition to independence is already incredibly difficult for this population, and they should have all the resources they deserve and are entitled to at their disposal to get themselves established. It's a lot easier to be looking for a job when you have a home. The money could also be used for saving for college or vocational training, buying a car, paying for internet or a cell phone, or any number of things. These young people have already endured more than many of us will in their relatively short lives. The least we can do is let them keep the money that is theirs. DHHS opted not to appear at this hearing, which is disappointing because I hoped to have the opportunity for committee members to ask questions of them. However, they have been really cooperative with my office in requests for information, and they have answered our questions in a timely manner. So I'd like to ask that any committee members that have questions for them, share them with me and my office, and we will compile them into a list of outstanding questions to submit to DHHS. They have agreed to continue to provide written requests for information, and I think this may be because they anticipate a lawsuit, which I think would be reasonable. But at the same time, I wish they were here to go on the record. I'll let you look at all the details of our questions and responses from DHHS, which I included in your packets, the FOIAs and the information that we got from DHHS. But I've hit most of the highlights in this opening. What advocates and I are looking for as next steps in possible legislation that would go through this committee is using Maryland's law as model legislation, as they have led the way on this, and several other states have also used their law as a framework. A court in Maryland held that foster agencies have to give notice to children and their lawyers when the agency applies to become the representative payee, when they do this thing. In Maryland, they said, you got to tell the kids if you're doing this. And that after receiving notice of the agency being appointed as their payee, children or their lawyers or their grown-ups can challenge it and request a different payee. The Maryland legislation was called Protecting the Resources of Children in State Custody. It requires that when an agency like DHHS is the child's payee, the state has to conserve the funds for the child in an account on a sliding scale increasing with age, with the intent that they have more savings as they get closer to adulthood. So starting at age 14, the state has to conserve 40% of their SSI funds. At 16, it's 80%, and 18, it's 100%. And this way, children have more of their own money available as they reach the age of transition and transition into independence. In the Maryland law, the state also has to provide financial literacy training to foster youth starting at age 14. And after consulting with local and national advocates, I think a bill like this might be something that we should try in Nebraska. Bills have been introduced at the federal level to do something about this specifically in 2007 and 2016, but those bills haven't moved, so it's up to the states to do something about it. I understand that Maximus, the contractor who does this, is a business. And like any business, they operate driven by their bottom line to maximize benefit to their clients and their profits. But I want to place the question in your minds as to whether a private for-profit company should be getting hundreds of thousands of dollars from Nebraska taxpayers to do this work. I understand that this work takes knowledge and skill, and that hiring a private contractor might make that easier for the state. But then why not hire a private contractor to do every government function then? I personally would feel more comfortable if this work was conducted by a government entity that didn't have a profit incentive when it's the money and the lives of these children at stake. The department is violating its fiduciary obligation when they take control over foster youth Social Security benefits and use those benefits for the interest of the state rather than for the interest of the child. This policy conflicts with federal and state law requiring that states must provide and pay for foster care services, not the children. Does it make sense for a corporation to be profiting off maximizing children's government benefits for the state? There's a book by, gosh, what's his name? Everybody knows what I'm talking about. Daniel Hatcher. And it's called The Poverty Industry. And I read it a while ago, and it's really good. The Poverty Industry. It's one that you might want to grab. And in that book, they cover this issue a lot too. And in the book, he says, quote, Maximus publications and advertisements have touted its ability to generate excess revenue for states. A Maximus presentation for the Nebraska Children and Family Services Agency explains the benefit of maximizing foster children's Social Security benefits as, quote, enhanced revenue for the state. They also suggest targeting children in juvenile detention to make them SSI eligible so their funds can quickly be obtained if they end up in foster care, which is likely. So the organization is not only helping the state take funds that foster youth are entitled to subsidize their own care, but they're targeting children who are vulnerable in the juvenile justice system, for example, who might end up in foster care, who aren't even in foster care yet, so we can snatch their funds up as soon as they get put into the system. The child, not the state, needs that money the most. Yes, it costs money for the state to provide care towards, but it is the state's responsibility, and that is the law. The children in care of the state didn't choose their life circumstances, and the state is taking away a resource meant to help them without telling them, without giving them any due process or ability to appeal. We should not be forcing foster youth to foot the bill for their own care. Thank you.
Thank you. Other questions? Senator Kavanaugh?
So many questions. But I'll start with the public records response from the department, which I appreciate that they gave you these responses, and thank you for sharing them with us. In reading over it quickly, and maybe you can give me your perspective on this, it seems that the department doesn't believe that they have a responsibility to notify children that are in their custody that they are doing this. Is that accurate?
Yeah, that's right. It's not against the law for them to not notify kids, but I think that could be challenged because, for an example, in Maryland, when that was challenged, the courts did find in favor of the foster youth, saying that that the money was their property, and because of that, the state didn't have the right to take it. And so if there was a court challenge in Nebraska, I think we could expect the same type of outcome.
Yeah, I'm looking at the legislation or the statute. I'm not a lawyer, so I can't say if it is actually, I don't know that Social Security benefits are an asset. I'm not sure that they've ever been qualified or quantified as such, but that seems to be the premise for this practice. But the responses here seem very clear that they are not notifying children, and they don't feel that they have a legal obligation to do so, which I find kind of bizarre.
Yeah. On the asset question, that is something that departments in many states have said in their defense, that, oh, we're taking the Social Security income because if that's counted as an asset for the kids, then they could become ineligible for other benefits. But there are a lot of ways around that, like putting the money in accounts that are exempt from asset limits. So like 529 accounts, saving for college. And there's also flexibility for those funds to be used for things like housing, education, transportation, employment training, food. These things are exempt from asset limits. And so, honestly, even if the state did nothing, that would be better than the state taking the funds, because then the foster youth would be able to access those funds as an adult.
Right.
So they would age out of foster care and apply for their SSI and get it all.
So
So that would be preferable to this.
that brings me to another question, and I don't expect you to be a Social Security expert, but
It's like cramming for a test when you do these things. It's like, I'm suddenly learning so much.
but on the last page at the top, the response about retaining the youth benefits, I was unclear. And I would ask the department this, and maybe if they're watching, they might follow up with clarification. But they don't, if they are no longer the recipient of the income, they return the funds to the Social Security Administration, noting that the child is no longer a state ward. The action of the returned funds is also recorded in the child's ledger. Social Security Administration, upon receiving the returned funds, will suspend payment until they are contacted. So that doesn't eliminate the opportunity for the youth to get access to the money, but the youth has to know to request to be the payee.
Say the last part of what you said again.
So the youth, if they're no longer a ward of the state returns the money that's been sent to them, and the Social Security office stops sending money to the state, but they don't start sending money to the child.
That's my understanding, yeah.
But they don't, but
And-
then that just accrues.
Yes, but in so many of these cases, the child was never made aware that they're entitled to these funds.
Right.
Yeah.
Okay, and the Social Security, as far as we know, there's no requirement for them to notify the child.
That's right.
Okay, thank you.
Other questions? Seeing none, thank you. Will you be staying to close?
Yes.
Okay.
Thank you.
Thank you. Anyone who would like to testify on LR 198?
Good morning.
Good morning.
My name is Allison Durr, ALLISONDERR, and I'm a staff attorney with Nebraska Appleseed. I'm here to provide a legal perspective on this issue. I will note I provided a more complete version of my testimony for you all, but I'll provide a summarized version out loud for the sake of time. So as Senator Hunt described, when a youth in Nebraska's foster care system is receiving Social Security benefits, the state will apply to be their payee, meaning they receive and maintain those benefits for the youth, and then they reportedly use that to pay for their foster care services. This practice is generally legally permissible for a couple reasons. First, federal regulations permit it. They allow state foster care agencies to serve as payee, although they do prefer the youth's parent, guardian, or relatives over the state. But nevertheless, if the state is appointed as the payee, they are then authorized to use that money for the youth, so long as they keep it separate from their own funds, use it in the youth's best interest, and spend it on the youth's, quote, current maintenance, which would be things like food, shelter, day-to-day needs, and also foster care services. And then lastly, state law says, as Senator Hunt mentioned, that the state is in control of state board assets. And once those assets reach $1,000, the state can begin using that money to pay for their care. But it's really important for you all to understand that just because this practice is generally legally permissible, the state still owes a lot of really important legal duties to youth when it does choose to engage in this practice. That includes their fiduciary and payee duties. It includes their duty as the youth's legal parent. It also includes their duties as a government entity to respect constitutional property and due process laws. And we believe Nebraska's current practice is inconsistent with some of these duties, raising some concerns. So the first concern is that Nebraska requires Maximus to apply for the state to be every state ward beneficiary's payee, despite federal law saying that state foster care agencies should be a payee of last resort. We know the Social Security Administration grants state payee applications relatively automatically. So that means that at no point in time is the state or federal administration actually asking if the state is the best payee for each individual youth, which creates concerns. Also, when the state takes money from youth to pay for their foster care services, it's unclear where that money actually goes. Is it in fact being spent on that specific youth? Is it going into state general funds illegally? That's really unclear right now and concerning. Next, as Senator Hunt mentioned, the overwhelming majority of youth don't know they have this money or are receiving these benefits. Because there's no apparent legal requirement for the state to tell them, the state does not tell them. This deprives youth of the really important ability to ensure the money's being spent in their best interest, and also of the opportunity to defend against the taking of their property because they don't know they had that property to begin with. This also creates a really unequal system where some youth in the foster care system are being forced to pay for services the state is obligated to provide them, when some foster youth aren't having to pay for their foster care services and other child welfare funding already exists for them. Another issue is the lack of oversight. The Social Security Administration only engages in intentional oversight of state payees every 4 years. And the Inspector General of Social Security has found that generally state payees lack oversight, resulting in hundreds of thousands of dollars in foster youth Social Security benefits being misspent in other states, including commingling with state funds, spent on things unrelated to child welfare. And without more oversight in our state, our foster youth are really vulnerable to these risks. And the last concern is by only keeping $1,000 for each youth, Nebraska does not effectively save these benefits for them to have when they leave care. This could be an attempt to avoid some public benefit asset limits, but as Senator Hunt mentioned, there are accounts payees can use to avoid these limits. So this saving is possible and could be really, really helpful for a population of youth, especially vulnerable to poverty and often don't have financially supportive adults around them. So this money could provide a really helpful financial foundation for these youth as they transition to adulthood. There are several ways Nebraska can improve its practice, and other states like Maryland and California have some really great examples we can look to. They don't say the state cannot be the payee or use the money this way. They just add more protections. And Senator Hunt already walked you through Maryland statute, which is a great example. Nebraska Appleseed would recommend a couple of things that state law should require. Some of these things I should say Nebraska is already doing in practice. This would just mandate them. The first is screen all state wards for Social Security eligibility and then ensure their successful application, and then also create individual savings account for each youth. Next, it should add accounting, oversight, and notification requirements for the youth attorney and juvenile court. And then very lastly, require the state to save a greater portion of benefits for each of these youth. With all of that, we thank Senator Hunt and the committee for your attention on this really important issue. I'm happy to answer questions, but I'd also refer you to my more complete testimony provided to you all.
Thank you. Are there questions? Senator Kavanaugh?
Thank you. Thank you for being here, Mr. One thing that's kind of standing out to me is you pay income taxes on Social Security benefits. Are you aware, and again, I'm kind of putting this question more to the department if you don't know the answer. Does the department then file income taxes on behalf of the youth if they're drawing down their Social Security money?
I don't know the answer to that.
Okay, because that seems like an important detail in a, if we're paying taxes on this money or not and how it's being utilized. So thank you.
Other questions? Seeing none, thank you for your testimony. Next testifier for LR 198. I think, why don't you come on forward? Welcome.
Thank you. Good morning. Chairperson Arch and members of the Health and Human Services Committee. My name is Cornelius Levering. First name is spelled Cornelius, last name Levering, Levering. I'm a former state ward of Nebraska and have 3+ years of experience working with child welfare organizations, including the powerhouse Nebraska Appleseed, who is present with us today. There are a lot of pressing issues that our world faces today, like climate change, affordable health care, and housing, for example. Some of us dedicate our lives to these issues. I've dedicated my life to this issue that we are present here for today, because it must end immediately. I'm here to testify on Legislative Resolution 198, Studying Youth in Nebraska's Foster Care Systems, Access to Social Security Benefits. First off, I ask for no one's pity here today. We are here because of poor human decisions that obviously must be rectified. I'm also here for the current 231 Nebraska children in foster care who don't know it yet, but are depending on us to do what is right for them. I was adopted and abandoned by my adopted mother at 15 years old. She left me no inheritance, but left me on a lonely road to figure out life as an adult by myself. What loving mother would do that to her child and face no consequences? I ask all of you today. Despite her not caring for me until I was of age, I still succeeded on my own will. I received the Susan Thompson Buffett Scholarship and graduated from my alma mater debt-free, which I'm very proud to say. Many of you could not fathom the level of poverty I experienced after aging out of the system with nothing, and I do mean nothing. My adopted mother had been married 3 times, and I did not know that she was married to a man who had been in the military and was deceased. Due to the changing of my brother and I last name, legally on paperwork, we appeared as this man's survivors. Any record of the $11,000 I had to my name has vanished like smoke in the wind. However, without a doubt in my memory, I did receive a $1,700 check from the Social Security Administration office when I coincidentally happened to be 19. Young and naive me, who just started college, I thought it was a scam. My foster dad stated, "If you don't want it, I'll take it." I cashed it and it helped out, of course. But I assure you, had this money not miraculously disappeared and I wasn't left with crumbs, my start to adulthood and independence would have been smoother, I'm certain. Child Welfare Services take these children from their home with the intention, I thought, to give them a better chance at life and protect them from any harm and danger. But it is the same organization who claims to protect these youth who are harming and stripping these great young men and women of their SSI benefits. If the Department of Health and Human Services is serious about protecting their children, state wards, that they removed on their own accord and accepting the role as temporary guardian, knowing the financial costs, they will at once end the illegal taking of youth SSI benefits to refill their coffers. I urge this committee to take serious concern over this matter, and I would like to thank Senator Hunt and the committee for looking into this important issue. Thank you. I'm here for any questions.
Thank you. Are there any questions from the committee? Seeing none, thank you for coming to testify today. Next testifier for LR 198.
Chairperson Arch and members of the Health and Human Services Committee. My name is Andrea Johnson Fee, ANDREA JOHNSON-FEE, and I am testifying today on behalf of Maximus. Thank you for the opportunity to share some highlights about Maximus, our partnership with the Nebraska Department of Health and Human Services, and how we work within Social Security Administration policy on behalf of children and youth in foster care and other out-of-home placements to ensure that life-changing supplemental security income, or SSI, and Social Security Disability Insurance, SSDI benefits are secured so that children may continue to heal and grow. Founded in 1975 with the mission of helping government serve the people, Maximus is a company that is focused on working with government at all levels. We partner predominantly with federal, state, and local agencies, working globally in 8 countries, in addition to the United States in the areas of health, human services, and other government programs. Critical for today, we have more than 19 years experience in the SSI, SSDI advocacy, eligibility, and assessment services. Maximus has been working in the SSI, SSDI advocacy arena since 2002, currently operating projects in the 9 states throughout the nation, including California, Delaware, Florida, Iowa, Maryland, Nebraska, New York, South Carolina, and Wisconsin, totaling 15 contracts supporting children in foster care and vulnerable adult populations. The purpose of this Nebraska SSA SSI advocacy project is to secure life-changing SSI SSDI benefits for children and youth who are Wards of the state, of Nebraska, I am aware that part of your interest is in how states direct and utilize the benefits to help pay for the cost of care or set up trust funds for foster children. It is important to understand that question is a state policy decision at the executive and legislative levels. Our role is to help secure the benefits, not manage or make decisions on the use of them. Maximus' approach to SSI, SSDI advocacy for children and youth who are wards of the state. Our process for the SSA advocacy work, which we do on behalf of children and youth for the Nebraska DHHS, is very straightforward and well-defined in federal and state policy. We fully adhere to the parameters of our contract with the Nebraska DHHS and within the federal policies set forth by the Social Security Administration. We have been partners to Nebraska DHHS since 2008, completing payee changes on behalf of DHHS. And in 2020, we began doing the full range services of SSA advocacy, including eligibility, functional assessment, advocacy, case management, medical reviews, and applications to SSA. We are proud of this longstanding partnership. Our notification process to children, care providers, foster parents, group homes, and residential treatment facilities, and child family service workers, who I'll refer to as CFS workers, is Maximus applies for SSI benefits for Nebraska state wards who are birth to age 19, who have disabilities. The youth, when age appropriate, the CFS worker, and the care provider are all contacted throughout the entire application process in order to submit a strong application on the ward's behalf. The ward, the CFS worker, and or the care provider all sign the required SSA forms. The most important aspect of what we do is making sure that the SSI and SSDI benefits follow the child when they leave custody. If approved for benefits, while a ward, benefits will follow them when they return home or when they age out of the foster care system. In some cases, such as qualifying for waivers, these benefits ensure access to programs they might not have had otherwise. This SSA advocacy process is very similar in all of the states we partner with to secure critical SSI and SSDI benefits for children in out-of-home care and vulnerable adult populations. We perform our work in each state as outlined in our contract according to the state's policies and their procedures. Additionally, all work that Maximus performs is adherence to SSA policy. We are honored to be a partner with the Department of Health and Human Services, securing life-changing benefits for our most vulnerable populations, and for youth, allowing youth to continue to grow and thrive. We are happy to answer any questions you may have now or in the future. This work means everything to me. I have devoted the last 17 years of my life to ensuring that children and youth in foster care and other out-of-home placements have every resource available to them through SSA. Thank you for your time today.
Thank you. Questions? Senator Kavanaugh.
Thank you. Thank you so much for being here.
Mhm.
You sparked my interest when you listed off some of the states that you operate in.
Yes.
And so let me just say first, I appreciate that you do what the state is asking you to do. So I'm not asking you to speak for the state or for the legislature, but if we were to move forward with legislation that aligned our regulations and practices with what Maryland is doing, which is what Senator Hunt had talked about, you operate in Maryland, that would be a feasible change for Maximus to pivot to if that was how we chose to move forward.
I'm not, because it's all state policy as the contractor, I would basically just say what the state tells me to do in that situation, or as the executive and legislative branches.
But it wouldn't be unfamiliar territory for you to.
It would actually not change your process at all.
Okay, thank you.
Other questions? Senator Day.
Thank you, Chairman Arch, and thank you for being here today. Could you just briefly, you mentioned a little bit about the process of identifying youth who are eligible for these Social Security benefits.
Yes.
And you said that that process is outlined all in state statute, or could you just walk me through what that process looks like and how you identify?
Yeah, it is. You would have to go to the state. There is a policy. They have there is a state policy for that, with working with us and when to notify us and things like that. What we do is a full functional there are, one of the handouts that I sent you was the 15 listings specifically for children.
Yes.
There are 15 listings also for adult, and within those listings, there are at least sometimes up to 8 different things that each child could qualify in, and you have to meet those listings in order to be qualified for SSI, for disability. And so one of the things we do is a full functional assessment, which is getting in, we speak with, depending on the youth's age, sometimes youth, depending on the youth's age, we speak with them. Most of the time we are speaking directly with the CFS worker or the care provider. And based on each age, Social Security has a function report that has to be filled out. And we also have a full functional assessment that we fill out that we have created to make sure that children, we don't want to file for kids who are not disabled or would meet the requirements for disability. And so we fill that out, and then everything that we fill out, every form that has to be signed, the youth is signing. Social Security requires every youth age 12 and older to sign their own release of information with regards to medical documentation. So every child 12 and up does sign that. And all the paperwork that needs to be signed, either our client at DHHS signs that paperwork before it goes to Social Security. So you either have paperwork that he's signing, and you have paperwork that the youth has signed and filled out, depending on the age. And also the care provider has witnessed, and the CFS worker is also signing. Does that answer your question? Or do you want more about how I determine if a child meets the medical condition?
Yeah, I guess
Okay,
my
no, that's
question
fine.
is more, I think Senator Hunt had mentioned earlier, we're even identifying kids before they're even wards of the state, right?
Well, no, we would not be able, if they're not a ward, we can't.
But if they're in the juvenile justice system, there's no identifying of kids there.
In DJ, we do not work with DJJ.
Okay.
So we cannot do that.
Okay.
So we don't work with DJJ
Okay.
in that aspect.
Okay.
In order to be considered eligible for SSI, even with SSA policy, you have to have a marked disability, which is mental or physical, and you would have to be continually seen for medical studies. I do suggest, if you're curious, the SOAR program for homeless and at risk, that their website, SOAR Works, has a lot of information. We're all SOAR certified. So
Okay.
if you look at that information, SOAR is making a huge comeback. They will have a lot of information on there if you're more curious about the process.
And that's SOAR?
SOAR. And then I believe it's SOAR Works, WORKS, yeah.
Okay, thank you.
And that's to help specifically with the homeless and at risk of homelessness population.
Okay,
Mhm.
thank you.
You're welcome.
Thank you.
You're welcome.
Other questions? Senator Wolf.
Thank you. All right, I'm just going to piggyback off Senator Day a little
Yes.
bit. You talked about, I think, going in and doing an assessment, and the child has to sign, or what? Can you explain that again?
Yes, Social Security policy requires that all youth 12 and older sign their own release of information in order for them to obtain medical on their behalf.
And they understand
Yes.
what that means.
Yes, we send a letter
Saying that you
detailing.
may be, you may
Yep,
be
yep, we
eligible
detail
for these
everything. We need these
benefits.
documents from you in order to do that, yeah.
Okay, but then there's no follow-up on whether or not they actually received the benefit?
That is again with state policy, so I'm only dealing with that. So we always notify the CFS worker if there's an approval, or so that it always letters go to the CFS worker
Okay.
upon approval, or to the state. They are the payee. So,
All right, thanks.
yeah, sorry. I can't speak to state policy,
Sure.
so I do apologize. Yes.
Senator Kavanaugh.
Thank you. Continuing off of Senator Day and Senator Walz's questions. Okay, so every child 12 and up must sign to authorize the release of their medical information
Yes.
for the application.
Yes.
And-
It's all connected to HIPAA.
So
and
without that information, you can't proceed with the application?
that is correct.
And do they understand that they don't have to sign?
Yes.
Okay.
They're well aware, yes.
How often does a 12-year-old or older not sign?
I could not give you specifics like numbers because I handle multiple states, but I can tell you it does happen.
Okay. So,
Sorry.
so and you said that they understand. How do they understand what they're signing?
They're in, most workers, we write a letter explaining, and then the care provider and the CFS worker often explain it to them if there are other questions.
But there's no, like, they don't read the letter to them and then.
I'm not there, so I don't know.
Okay.
Sorry.
So you don't know what the process is to make sure, to ensure that the 12-year-olds, that we are in compliance with them understanding.
Yeah, that I'm
Okay.
not sure.
Okay, I'm mostly stating this for the record so that
No,
when
that's okay.
DHHS comes back to us with information, they can tell us.
Okay, yeah, no, that's fine.
And if you know the answers, that's
Yeah,
just
no,
a bonus.
We do have workers ask us to explain stuff more once, you know, like, hey, can you explain this a little bit more, especially with medical reviews that we do. And so I do know it's being explained. I just
Don't
it's
know
state-
in which way.
Right.
Okay. Okay, thank you.
You're welcome.
Senator Jay.
Thank you, Chairman Arch, and thank you again for being here today. And I promise this isn't meant to be like a gotcha question.
No,
but-
that's okay.
But I think the issue that I see with what's happening is that it appears that, especially if we have like a for-profit private organization who is responsible for identifying and gathering these funds, it appears that that would be being done more on the part of the department and not necessarily the child. Is it fair to say that in your services, even in an internal presentation, are marketed as a way to increase revenue for the department?
I can speak to that. No.
Okay.
What we do is the majority of the children that we are helping, that we try to help, are youth who are aging out, youth who are in, like what's been said is we want to help youth who have disabilities so they have those services when they return home, you know, or when they age out. And a lot of parents don't always know that help is available to them for that child. And so when they come into custody, a lot of children can come into custody due to behaviors. And again, this is a state policy, but you know, we want to help them so they have those services when they go home. That's the biggest thing, because a lot of them might not have that if they don't have someone like us applying for them.
Yes, and that makes sense to me, and I
Yeah.
appreciate that. And I do believe that that's obviously your goal here.
Yeah.
It just looks a little bit on the surface like the goal would be to bring money into the department to pay for the services, as opposed to bringing money in to give it to the child, right? So that was just my question.
No,
is,
and that makes
has
sense.
it ever been, you know, when there's a partnership created between yourself and the department,
Right.
is it ever discussed that your services can provide funds for the department to mitigate their costs for services?
I think that I can't really answer that, to be honest with you. I
Yeah.
mean, I will tell you that an average SSI advocacy case takes between 4.5 to 12 hours to complete. So if you think about that in terms of having someone like us completing that over having, you know, you would have to hire workers and things like that, so.
Okay, thank you.
Other questions? Okay, I just want to make sure I understand the process. So
Yes.
a child becomes under the custody of the state, and that child is referred to you for an evaluation as to whether or not that SSI would be available for that child. So that's the universe, right? Every child that is new into a state ward population.
Probably not every child is referred that first comes into custody.
Okay.
But yes.
So of those that are referred to you, have you found, and maybe you would not get the referral, are there children in custody of the state who already have SSI determination?
Yes, yeah.
Would you see those?
We would see them to do the payee change, but we would not see them to file an application since one is already there.
Okay.
Of the referrals we have gotten since we started doing this for the state, only 5 of them were already receiving SSI or had pending SSI applications.
Okay. So how many on an annual basis then are receiving a positive determination for disability for SSI through your work?
Through my work, we've, so far, we have 10 approvals out of our 40 cases that we have filed so
In
far,
this year?
since January, yes.
Okay.
Technically March, we started in January, but I think we didn't start sending cases till the end of February, but.
Okay.
Yeah.
All right, thank you.
Mhm.
Sarah Day.
Sorry, I have one more question. I promise.
No,
It's
that's
my last
okay.
question. So again, going back to, them saying that they're signing and they're aware that,
Yes.
they're signing away their medical or whatever. Are they aware at that time that then could potentially make them eligible for the $700 a month in benefits?
That's, thank you for the question. That's more probably a state policy question. I am not there physically, so.
Okay.
I don't know. So,
Yeah, no, I appreciate that. Thank
No
you.
problem.
Thank you. Other questions? Seeing none, thank you very much for your
Thank
testimony.
you.
Anyone else wish to testify on LR 198? See no one. Senator Hunt, you're welcome to close.
Thank you, Chairperson Arch. Thanks, colleagues on the committee. I'd like to sincerely thank Cornelius and Ms. Johnson-Fee from Maximus and Appleseed for being here today and taking the time to engage on this. And thank you to Senator Arch for holding this hearing. It's really important to me that we had this hearing to get the best information possible to proceed with these improvements. And I think that what Ms. Johnson-Fee said was really helpful because it really made it clear that the kids in Nebraska have no idea that this is going on. As I said in my opening, a Maximus presentation for the Nebraska Children and Family Services Agency explained the benefit of their services as, quote, enhanced revenue for the state. And this might be old, it might be something that happened a few years ago, but we know that this has been presented to the state this way. And this is something the state has chosen to take advantage of. So we as legislators have to examine that and make sure that if that's the procedures we're going to do, if that's the policy we're going to take up, do we need to revisit that and bring more transparency to that process? Do we need to bring any kind of due process procedure to that? And, that's the opportunity we always have in this job is to see, okay, we passed this policy. Is it doing what we wanted it to do? And in this case, I don't think so. Much of the background information here that I've provided is paraphrased from the work of Dr. Daniel Hatcher, who I mentioned in my opening. He's a professor of law at the University of Baltimore and an author who has studied and written about this issue at length. His book, The Poverty Industry, is the source of a lot of the background information on this and also informed the NPR investigation. In your materials I've shared is one of the law review articles on the subject. Mr. Hatcher has also been in communication with my office, and he's offered himself as a resource to me and to all of us for additional information as we look into drafting a bill. About the cost to the department, I'm not sure that it would be such a bad thing if we took the $300,000 plus that we're paying to Maximus and allocated it to DHHS, or maybe even less than that it would cost to have this done in-house by our own, accountable government representatives who, I think that there's ways that we can look at the procedure there and make sure that it's cost effective for taxpayers and transparent for the youth who are affected. I just want to emphasize that child welfare agencies exist to protect and serve the interests of vulnerable children. Federal law already requires that states pay the cost of foster care, not the children. By intercepting foster youth Social Security benefits, the state of Nebraska is forcing abused and neglected children to self-fund their own care. And we know that's not right. There's a lot of interest from this in all sides of the political spectrum, and this is a real opportunity for the HHS committee, the legislature, and the Department of Child Welfare advocates to work together and correct some deficiencies in our current system to better serve our youth. It's not controversial or partisan, and I think this is something anyone can look at and say, okay, something needs to change here, because foster youth should not be a revenue source. I share the sentiment of Ms. Johnson-Fee that this is been a passion of hers and a life's work, and that we want to make sure that children have every resource that's available to them. Well, we know for a fact that our kids don't have every resource available to them. They specifically, literally don't have their resources available to them. And that's something that we can work bringing transparency forth through this committee. So please send me any questions that you have for DHHS. They only want to communicate via written communication. And I hope that we can formulate a plan that we can all get behind and hit the ground running in January and get something positive done together. This committee will probably be tackling lots of contentious issues this next session, and I hope that this won't be one of them. Really happy to work with you. Let's compromise. Let's make it work for everybody. And I'd love for you to reach out to me if you have any questions. Thank you.
Any concluding questions? Senator Mervin.
Thank you. Maybe I should have asked Maximus this question, but I think they mentioned they do this service for 9 states. So the other 41 states, do they all do it in-house, or is there another business that does that?
There are other contractors that do this.
You know how many are?
I know of 2. One of them is Maximus. It's in the materials that I handed out to you, but I could take 3 minutes and find it.
No,
But
that's fine. Thanks.
sorry, I can't say that on the record.
Any other questions? Senator Kavanaugh.
Thank you. Thank you, Senator Hunt. I think you said this in your opening, but you did invite DHHS to come here today.
Yes.
Okay. I just find it very disappointing because we had 3 hearings and they didn't show up for any of them. And the point of these hearings is to craft strong public policy next session. It's hard to do when we can't get a partner in the agency. So I appreciate you inviting them to come. And I just want to say publicly that I'm extremely disappointed that they only show up when we subpoena them. So thank you.
Other questions? Senator Walls.
Thank you. I just wanted to clarify, so the total contract with Maximus is 301,000 or?
Yep.
Okay.
301,500.
All right. That's all.
Other questions? Seeing none, thank you very much.
Thank you all.
This will close the hearing for LR 198 and will close the hearings for this morning for the committee. Thank you.